Hello, my name is Patrick Schultz and I'm a student physical therapist. Today I'll be demonstrating how to perform joint mobilizations of the patella. As you can see, I have a knee model here and I will be demonstrating these techniques as I describe them. First, it's important to note that the range of motion of the patella is limited, so it's something like this. Grade 1 mobilizations are small oscillatory mobilizations that are performed early in the range of motion, so they look like this. Grade 2 mobilizations are larger amplitude oscillatory motions that are performed at the mid-range of the motion, so like this. Grade 3 mobilizations are also large amplitude mobilizations that are typically performed where restriction is noted. So if the patella cannot go laterally, then you would want to find that place of restriction and you would perform the oscillation there. So they look like this. Grade 4 mobilizations are typically performed at the end range and they are small oscillatory motions and they look like this. So going forward I will show you later in the video how to actually do these on a patient. But for example, if a patient was having a knee flexion limitation, you would want to do an inferior glide. So they would look something like that. If a patient was having a knee extension limitation, you would want to do a superior glide. So something like that. If a patient was having a knee internal rotation limitation, you would want to perform a medial glide. In a knee external rotation, you would want to perform a lateral glide. It is also important to note that if they're having just generalized range of motion restrictions, you could perform a patellar tilt.
So as we were performing your evaluation, we noticed that there was some limitations in range of motion of your knee, so you couldn't get as much motion. So there's a technique that we do as physical therapists called Patella Mobilizations. And basically what that is I'm just going to take this kneecap and I'm going to put your leg in a relaxed position. And I'm just going to move this kneecap around side to side, up and down. And hopefully the goal is to improve range of motion and to decrease pain in that knee. Are you okay if we try that?
Yeah, definitely.
Okay, cool.
When performing patella mobilizations, the first thing you should have your patient do is lay supine. Once they have obtained the supine position, it is recommended that you find the open pack position of the knee, which is 0 to 10 degrees of flexion. To obtain this position, you could use a bolster or a towel or anything that you could slide up under the knee. So as you can see, I'm sliding the bolster under the knee. So first, what you need to do is you need to grasp the patella with your pointer finger and your thumb. You would want to assess the mobility of the patella. So as you can see, there's not a whole lot of mobility here. To perform a superior glide, you would want to grasp the inferior pole of the patella and you would want to provide a superior glide. And keep in mind that you can perform this as a grade 1, a grade 2, grade 3, or grade 4 mobilization. To perform an inferior glide, you would want to grasp the superior pole of the patella and you would do the same principle and you would push that way. The same holds true for a medial and a lateral glide. So a medial glide, you would want to grasp the lateral side of the patella and you would want to provide a medial force. And depending on your grade that you're looking for will depend on exactly your oscillations and the speed. A lateral mobilization, you would want to grasp the medial side of the patella and you would perform your mobilization. As I mentioned earlier, if you just notice a patient that has a lot of knee restrictions, then it is recommended that you perform a patellar tilt. So a patellar tilt would just mean that I would place my fingers on the lateral or on the medial side and I would provide a tilting or a posterior force to obtain the patellar tilt. In closing, joint mobilizations of the patella are a very easy and relevant clinical tool to have in your toolbox. Joint mobilization should be performed 20 to 30 times in the desired direction and can be performed by the patient themselves at home as part of the HEP or can be performed by the physical therapist. As mentioned, joint mobilizations can be used to decrease pain and to improve range of motions. So grade 1 and grade 2, once again, are used to improve pain, and grade 3 and grade 4